So today I'll be discussing with you acute renal failure, also known as ARF. What is acute renal failure? It's also commonly referred to as acute kidney injury. ARF is a sudden or rapid decrease in the kidney's excretory function. This includes glomerular filtration, waste extraction, urine formation, and urine output. If undiagnosed or untreated, a complete loss of kidney function and kidney failure will occur. This right here is an image of the end-stage renal failure. This is when no filtration is going on and the kidney's functions are at a complete loss. The causes of ARF. ARF's main causes include impaired blood flow to the kidneys, urine blockage, or direct injury or damage to kidneys. These all stem from diseases, infections, or conditions directly affecting the kidneys and their function. So, for example, the impaired blood flow to the kidneys can be caused by fluid loss or dehydration, heart attack or heart disease, infection, prescription drug abuse, or severe allergic reactions. The urine blockage can be caused by cervical or bladder cancer, enlarged prostate, or kidney stones. The damage to the kidneys. This can be caused by medications, melanoma, toxins such as alcohol or cocaine, use, blood clots around the kidneys, and inflammation. Individuals who are at risk for developing ARF. These are hospitalized patients, so people who are already in the hospital are at a higher risk, patients having surgery, individuals who are of older age, such as 65 years and older, and especially individuals with coexisting diseases or illnesses, such as diabetes, CKD, chronic kidney disease, liver disease, peripheral artery disease. Manifestations of ARF. Common signs and symptoms are decreased urine output, which is known as oliguria or anuria, confusion, edema, hypertension, increased blood pressure, chest pain and pressure, swelling in legs and feet due to fluid retention, fatigue, and even nausea and vomiting. So the next thing I'm going to discuss are the treatments for ARF. So most patients, when they are diagnosed with ARF, they need to be hospitalized if they are not already. So what the nurse and caretakers are going to focus on are fluid balance. This is if they have not enough fluids, they're going to give them IVs. If they have too much fluids, they're going to get them on diuretics. Just empty those out. Controlling blood potassium levels. This is used by medications. This is just taking the calcium and blood glucose, controlling those. The next thing is restoring calcium levels. Calcium infusions are going to be used if the calcium levels are too low, and importantly, removing toxins in the blood. And this is considered more serious, but this is used, or dialysis is used for removing these toxins. So what dialysis is a machine that pumps your blood out of the body through an artificial kidney, which is a dialyzer. This will filter the blood, and the blood is returned to the body. This is usually in the more severe cases of ARF. Excuse me. Prevention. Steer clear of acute renal failure. How to prevent acute renal failure? Some primary preventions is staying hydrated, maintaining mean arterial pressure. This primary preventions for high-risk patients includes close monitoring of urinary output and creatinine levels. Avoid nephrotoxic drugs, which are drugs that are damaging to the kidneys, and avoid iodinated dyes. Secondary preventions include urine tests and regular health checkups. Complications of ARF. This includes muscle weakness. This is usually due to the fluid and electrolytes being off, unbalanced, and what is very unsafe is the increased levels of potassium. Another thing is chest pain. This is due to the pericardium inflammation that can occur. Buildup of fluid in the lungs. This can lead to shortness of breath. Permanent kidney damage. This can result in the end stage of renal disease. If this happens a lot of times, this is when the nurses or the doctors will implement kidney transplants or want to implement that into the patient's plan. And the worst complication of ARF is death. This is the complete loss of kidney function, buildup of toxins, and just very rough on the body. This concludes your lesson on acute renal failure.